Sarcoidosis is a disease. It's not contagious. This means you can't catch it from someone else, nor can you pass it on to others. It happens when tiny clumps of cells grow in your body. These clumps are made up of immune cells that cluster together. These clumps are called granulomas. They form as a response to inflammation. Granulomas are like little bumps of inflammation. They can appear anywhere in your body, affecting various organs and tissues. But they often show up in your lungs, lymph nodes, or skin. These are the most common sites, but other organs can be involved too. Sarcoidosis is a complex disease. It can present in many different ways, making it challenging to diagnose and treat. Doctors don't know exactly what causes it. There are many theories, but no definitive answers yet. It can affect people of all ages and races. However, it is more common in certain populations, such as African Americans and people of Scandinavian descent. It's important to remember that sarcoidosis is often treatable. With the right medical care, many symptoms can be managed effectively. Many people live normal lives with this condition. They can work, exercise, and enjoy their daily activities with proper treatment and monitoring. Imagine your body as a network of roads, with each road representing a different pathway for essential functions and processes. Sarcoidosis is like roadblocks appearing throughout this network, causing disruptions and delays in the smooth flow of traffic. These roadblocks are the granulomas, which are small clusters of inflammatory cells that form in various organs. Granulomas disrupt the normal flow of things, much like a traffic jam can bring a bustling city to a standstill. They can affect how organs work, leading to a range of symptoms depending on where they form. The organs most often affected are the lungs, lymph nodes, skin, and eyes, but sarcoidosis can potentially impact any organ in the body. When granulomas form in the lungs, they can cause shortness of breath and persistent coughing, making it difficult to breathe normally. In the lymph nodes, they can cause swelling, which may be noticeable as lumps under the skin. On the skin, they can cause rashes or bumps, which can be itchy or painful and may vary in appearance. The severity of sarcoidosis varies greatly from person to person, with some experiencing only mild symptoms that may not require treatment. Some people experience mild symptoms, while others have more serious complications that can significantly impact their quality of life. These complications can include organ damage, chronic pain, and fatigue, making daily activities challenging. Treatment for sarcoidosis often involves managing symptoms and preventing complications, with options ranging from medications to lifestyle changes. Regular monitoring and follow-up with healthcare providers are crucial to ensure the best possible outcomes for those living with sarcoidosis. With proper care and support, many people with sarcoidosis can lead fulfilling lives despite the challenges posed by the condition. Sarcoidosis can be tricky to diagnose. Its symptoms often mimic other conditions. Some people experience no symptoms at all. However, common signs include fatigue, persistent cough, shortness of breath, and skin rashes. You might also experience chest pain, weight loss, or night sweats. If you experience any of these symptoms, it's important to see a doctor. They can run tests to determine if sarcoidosis is the cause. Early diagnosis and treatment are crucial for managing the condition. The exact cause of sarcoidosis remains a mystery. Researchers believe it might be an autoimmune disease. This means the body's immune system mistakenly attacks its own tissues. While the exact trigger is unknown, several factors might play a role. These include exposure to environmental triggers like dust, mold, or certain chemicals. Genetics might also play a part. People with a family history of sarcoidosis might be more susceptible to developing the condition. Section 5. Exploring risk factors. In this section, we will delve into the various elements that can increase the likelihood of developing sarcoidosis. While anyone can develop sarcoidosis, certain factors can significantly elevate your risk. These include age, ethnicity, family history, and environmental exposures. Sarcoidosis is most commonly diagnosed in people between 20 and 40 years old. This age group seems to be particularly susceptible, although the reasons for this are not entirely clear. African Americans and Northern Europeans have a higher risk of developing sarcoidosis. Studies suggest that genetic factors may play a role in this increased susceptibility. Having a close relative with sarcoidosis increases your risk. This familial link indicates that genetic predisposition is a significant factor in the development of the disease. Exposure to certain dusts, molds, or chemicals might trigger sarcoidosis in some individuals. Occupational and environmental factors are being better. It's important to note that having these risk factors doesn't guarantee you'll develop sarcoidosis. They simply increase the probability, making it more likely compared to those without these risk factors. It just means you have a higher likelihood compared to the general population. Understanding these risk factors can help in early detection and better management of the condition. Section 6. Treatment options and management. There is no one-size-fits-all cure for sarcoidosis. Treatment aims to manage symptoms, reduce inflammation, and prevent organ damage. Medications like corticosteroids are often prescribed to reduce inflammation. In some cases, immunosuppressant drugs might be necessary to suppress the immune system's overactivity. Lifestyle modifications also play a crucial role in managing sarcoidosis. This includes eating a healthy diet, getting regular exercise, and avoiding smoking. Section 7. Living with sarcoidosis. Living with sarcoidosis can be challenging, but it's important to remember that you're not alone. Support groups and online communities offer valuable resources and connect you with others facing similar challenges. Managing stress is crucial as stress can worsen symptoms. Engage in relaxation techniques like meditation or deep breathing exercises. Maintain open communication with your healthcare provider. Inform them about any changes in your symptoms or concerns you might have. Section 8. Seeking medical help. If you suspect you might have sarcoidosis, it's crucial to seek medical attention promptly. Early diagnosis and treatment can significantly improve outcomes and prevent complications. Don't hesitate to ask your doctor questions and advocate for your health. Remember, knowledge is power when it comes to managing any health condition. With the right medical care, support, and self-care, you can live a full and meaningful life with sarcoidosis.